one common problem with a lot of women's breasts is that they're uneven. What is it that you can do to kind of alleviate this asymmetry?
You're right. A very common problem is breast asymmetry. This is the medical terminology for having uneven breasts. It all depends on how severe the problem is. Oftentimes, this problem is not very severe, and when you have a breast augmentation or you correct somebody's breast volume on the sides, the problem essentially solves itself. But for others, the unevenness is so severe that it shows through clothes, and they definitely are uneven when they wear a bathing suit. So in those individuals, it's important to correct the uneven size of the breast. The best way to correct the uneven size of a breast is to try to match everything in the same way. And when I say that, I don't mean that what you want to do is to, for example, put a larger implant on one side and hope that that would correct the problem, because usually that does not correct the problem. An uneven breast often has a different amount of skin, it has a different amount of breast tissue, and it may have different positioning of the nipple on one side to the other. And if you just put a different size implant on the other side, which is smaller, for example, that may not solve the problem. So the way that I do it is that I make sure that the person has equal volume of breast, meaning the same amount of breast tissue to begin with. I make sure that their skin is the same. I make sure that their nipple position is the same. And then I choose the same size implant to enhance the volume or the size of the breast on both sides if they need it. That's the best way to correct breast unevenness problems.
So you usually do this operation with implants, essentially?
It may be necessary to do the operation with implants or with reducing the larger side. It all depends. And that's why it's important to really look at the breast and see what is lacking on one side and what is excessive on the other side, and try to match it to the best possible fashion.
Generally, how long is a recovery for someone who's undergone procedures to alleviate their breast asymmetry?
It's about 1 week.
About 1 week. And then if an individual wants to correct this, what should they look out for?
I think again, the most important thing for them to look out for is the idea that you do not want to just correct one aspect of the problem, meaning if the person has a breast that's smaller than the other side, you don't want to just go and put a larger implant on that side, because that's not going to correct the problem. You really need to address everything on that breast, including skin, the nipple, the breast tissue itself, and perhaps other aspects of the breast. For example, if there's any skeletal differences, if the rib cage is different. All of these things have to be addressed separately in order to get the best shape possible.
And then how long after they have a procedure can they get back to their normal routine?
Generally speaking, about 1 week.
About 1 week. And if someone really wants to fix their breast asymmetry, what's the first step that they should take?
I think the most important thing they can do is to go and see a well-qualified plastic surgeon. That surgeon can then tell them what is missing in one breast versus the other, or what's excessive in one breast versus the other. If it's an issue of skin, if it's an issue of breast tissue, if it's an issue of skeletal problems, all of these things have to be addressed. And that's the only way, really, to get the two breasts to become even again.